Hello, are you one of the millions of people around the world who suffers from a terrible skin rash, whether it's rosacea, eczema, or any other type of skin rash that's unanswered by medicine? If the answer is yes, raise your hand and say yes. Are you one of the people watching this video who's got a loved one who's been diagnosed by a dermatologist or by an infection specialist having a certain rash according to a certain blood test or a certain condition, yet the medicines have not provided relief? If you're one of those people, or one of your loved ones is one of those people, say yes. In this video, you're going to see right now the before and after of a woman who suffered for 5 long years of her life. 5 years. Look at the before, and now look at the after. And it's just remarkable. Look at those side to side, and it's remarkable at the recovery she's gained from working with me, even after she went to doctors years ago, who she trusted, who she thought were the answer. 6 dermatologists. They ran tests. They could not figure it out. And then she came over here to something that was different, something that I presented to her that opened her mind and said, maybe this is possible, that I can recover. And now look at the before and after. It is remarkable. There were no medicines used, and it wasn't only a specific type of autoimmune disease diet protocol, or healing the gut was not even part of this. My name is Dr. Lonnie Herman, and in just another moment, we're going to come back into this video and share with you all of the different exam findings that were unique to her individual body that provided her the incredible recovery. And this goes for any other person on this planet who's dealing with a terrible skin disorder, regardless of the diagnosis of the skin disorder. Let me put up some other pictures right now of before and after of other patients in my clinic with terrible skin rashes. And it's not just 1 in a million. Any person with the right method can heal. Let's take a break for a moment, and I'll be right back. Before and after right now, and we still have a bit more to clear up, but amazing difference in your face. And you suffered for how many years with the red nose and the rash that was on the skin?
Almost 5 years.
5 years. And how many different doctors? Well, you had seen dermatologists, right?
Yes.
And how many of them were there that you saw?
6 different dermatologists.
And over what period of time did you seek out care from these 6 different dermatologists?
I was throughout the time I've been suffering so long, throughout the different years. I would go stay with one for a few months. Nothing, they couldn't give me an answer. They couldn't figure out what it was. Then I would go for another opinion a few months later.
Okay.
And I just simply wasn't getting any answers as what possibly the skin condition was.
And what type of testing did these dermatologists offer you?
They did a scraping to see if it was possible a fungus, and that came back negative. I also believe I did blood work, and it did not show anything. Then they just would put me on antibiotics, and also antibiotic cream, topical and pill form.
Did any of those sometimes make the rash worse, or did it just make no difference at all? No better, no worse?
It did not make a difference.
When you went from one dermatologist to another, and you had already seen 3 or 4 before you saw 6, when you saw it by the 4th one or 5th one, did you say, do you have anything else to offer me? Because here's a test that we've done and nobody's figuring out what it. I mean, did they ever say, well, we have a new strategy?
Yes, they said they can cut a piece of the skin, but they did not want to do that to send it out for further testing, because since it was on my face, they didn't want me to have a scar.
Right, gotcha. So there was really nothing else then?
No, that was the last option, which we decided not to do since it was on the face.
Got it. And all the areas on the face where people could see the before, there was an oozing as well, you told me? I called it oozing. You may have a better description.
No, it was also. It
was an oozing. Yes. It was a white kind of pus-like stuff that was coming out?
Yes.
You called them plugs? That's a
yes.
term for me, plugs.
Yes, like white little plugs.
Like a string
out in your skin. Yes.
Yeah.
And now we see that she's 100% nearly, if not perfect, 100% better. There's a little bit on the cheek that we're going to clear up, and that's going to be clear after this protocol. I believe that is going to be totally done. But it's amazing before and after. And your family, just by the way, and then I'll let you go. And I appreciate you getting on this discussion with me today to share with the world the difference for your skin. What does your family say? What does your mother say? What does everybody say?
They're amazed. They can't believe what a difference and how my skin looks so amazing now. And they're completely amazed at the transformation. I was so desperate. I wasn't getting help from anywhere. Plus, it's your face. You feel very self-conscious. And I came to see Dr. Herman. And thank you, Dr. Herman. You cleared up my skin. And now I feel more confident and have a little more self-esteem and don't have to always, want to mask up.
Yep. Excellent. Thank you so much. And when you're pain-free from the juvenile RA, which is part of her autoimmune condition that brought this on, when you're pain-free from that and off that antiviral medication, which she took that medication for the RA, it didn't clear up the skin. So the skin still happened. Anyway, when you're done, that we can share that amazing recovery because that's coming your way too. And I'm sure of that. So
yes, I can't wait.
Awesome. Thank you for getting on this call. And I appreciate you letting me share this with everybody out there in the world who needs help, just like you have. Okay.
Of course. Thank you, Dr. Herman.
Welcome.
So if you're a person, again, who's suffering with a terrible skin disorder where medicines and diets and lotions and potions have not provided you relief, you deserve to listen to my presentation because we've got the answer for you. And your own puzzle that we have to solve to stop your terrible skin rash is unique to you. It's unique to you. In a few minutes, I'm going to share with you a great picture that you can understand, a great analogy that will help you understand why you're different than another person, but still it's getting you the same result, which is clear, perfect skin. You can regain your normal, healthy skin. So right now we're going to share her exam findings and you're going to hear her whole incredible testimonial again. And then I'll share with you some other information about my clinic and how to set an appointment here. So if you're here, let me tell you, by the way, this is more than just an informational video. In this video, I am here to help you become one of my patients. I can help you get the result that you've been searching for. So yes, I'm here to help you. I'm here to help you more than just know what is possible. I'm here to help you achieve what is possible for you. And the only way that we can do that is by you coming into my clinic, and we'll get to that in just a few minutes. So sit back and listen easily. You can listen to what I'm about to share and you'll understand why this works and what different methods you've tried for you obviously have not worked for you in the past. Her first examination with me, and by the way, today is January 19th of 2022, and her first examination with me was in February of 21. Her second examination with me was in July of 2021. And her third examination with me was just last week in January of 2022. When she came back into my clinic in January of 2022, her skin is perfectly clear. And she's excited. Her family, her friends are all excited. It's amazing what she's achieved with my work and with her body's ability to heal. So first thing we're going to do is share with you what I found at her first exam, that she followed a protocol at home. She followed another protocol from her second examination to get rid of, and here's the key, we have to find the different infections and or toxins and or activated mast cells that are releasing inflammatory substances into the tissues. We have to find these and neutralize them with safe and highly effective liquid drops. Now I get into more about my technology and my method on my website. I'll share with you the link down here to my website as well as below this video. Also on my website, you can look at about my unique quantum food sensitivity assessment examination that we perform on every patient, and we did with her. I'll share with those findings with you that may blow your mind of what I found with her that we had to remove from her diet for a little while, but we're fixing the causes of the food sensitivities. Also, you can go on my website and download my book for free about how you can reclaim your health, how you can use quantum energized medicine protocols to actually reverse seemingly incurable chronic illnesses or chronic diseases. Download my book, read it. It's very simple, 40 pages. Maybe it'll take you about an hour. And inside that book, there are a lot of big pictures. It's big font. There's not too much reading, literally maybe an hour. There are three links inside my book that you should click on and read more about my work, about the quantum food sensitivity assessment, about my quantum dental assessment, as well as on the very last page, I highly recommend, because you're going to want to know how I do what I do for people. I give a brief insight to that on my journey as a physician to become your physician who gives you the answers, as well as into my method of how I'm doing what I'm doing and the science behind it. On the very last page, click that link. It brings you to a private page on my website. And on this page, you can watch a 42-minute video in where I'm presenting my journey as a physician, the type of labs I used to run, my education, my background, as well as my method. Okay, so right now let's listen to what caused Miss Bellows' skin problem. Now, by the way, she's been diagnosed ever since she's just after 6 years old. She's been diagnosed with juvenile rheumatoid arthritis. She had inflammation for years, ever since she's a little girl. Over 30 years of dealing with an autoimmune condition. She's been on medication for 20 years to reduce the pain that is associated with her rheumatoid arthritis. That we will achieve later by removing more of these infections and toxins that have built up in her body over the years that made her suffer from this rash, as well as from the rheumatoid arthritis, joint pain, and inflammation. And she will achieve that with this work. That's for certain. So what we found first here was that her lungs were infected with multiple different molds, Aspergillus fungus. Some people call that a mold as well. I found the parasite from malaria in her lungs. I found a group B Streptococcus bacteria in her lungs. I found, by the way, before I tell you about the next finding, she had 5 different teeth that had to be extracted. Some of them were root canal, some of them were just decayed. We had to get them out of the mouth, which I discovered in my quantum resonance dental examination. She had already been going to a dentist every 6 months for dental cleanings and x-rays, and they never found she had infection in her mouth. They never told her. They never even realized that part of her rheumatoid arthritic problem, a part of her face rash, was coming from her teeth, in part. So we had those teeth extracted. I'll tell you more when I get to meet you in person what I do with those, but I found that those teeth, all of them, were infecting her lungs as well. Now, one thing to really understand about the lungs, why is this important that we had to address the lungs to help her heal from this terrible rash on her skin, on her face that she's looking at. It's not like she could cover it up with her clothes. It was right there in front of everybody for 5 years, every day, every night, no break, no reduction until now. The thing is, your blood, in order to bring blood to your skin, to your eyes, your hair follicle, your sweat gland, to your thyroid, to your stomach, to your kidney, to your liver, to your every part of your body, to your bones, your blood has to go to your lungs to drop off the carbon dioxide that we exhale and pick up the oxygen. So when that red blood cell captures the oxygen in the lungs, and it's also capturing different kinds of disease causing infections, molds and bacteria, parasites, viruses, fungal infections, and or chemicals that can be in the lungs, the blood is going to pick up those infections and carry it like getting in a taxi and driving to a place. The blood is going to carry it to your skin. It can carry it to your brain. It can carry it to your liver. It can carry it to your bladder and make these organs infected. So we had to clean up the lungs first from these different infections, some from the teeth that were in her mouth as well. I also found that her sinus cavities in her skull here, they were infected also from those teeth. And where are the sinuses? Right by where the nose and the cheeks are. Where was her rash? Let's look at the before picture again. Right by where the sinuses are, she had the rash. She had infection from her teeth in her sinus cavities. She also had Cryptococcus fungus and Aspergillus fungus in her stomach. She had mold in her whole lymphatic system. She had 𝐊𝐄𝐒 virus affecting her spleen. Her teeth were infecting her thyroid gland. She had Lyme disease, Lyme co-infections, Borrelia bacteria, and the Lyme disease common co-infections in her stem cells, in her bone marrow. She had parasites affecting her cartilage. She had Lyme infection in her lymph. She had the infections from her teeth I found in her skin. We provided safe and highly effective liquid energized drops that helped neutralize these infections, help her body fight those infections and rid them. And they came out, because you can see again, here's the before and after. They came out of her. But it wasn't just from the first round. When she came back the second time in July of 2021, she still had a horrible rash on her cheek, around her eye, on her nose. Horrible. That next round, she had to get a couple of more teeth extracted. I found with her that she had mycotoxins, mold toxins that are released from molds in the body, toxins that are very toxic to us that can cause harm, cause inflammation, like an autoimmune disease in all of her cartilage. I found Marcons, M-A-R-C-O-N-S, that's a multiple antibiotic resistant staph bacteria in her sinuses. I found she had activated mast cells in all of her cartilage. I found her teeth infecting her cartilage. I found her ligaments affected by mold and mold toxins and various fungal infections. Her tendons infected from Marcons. Her stomach and her joints infected by molds and mold toxins. Her kidneys infected by her teeth. Yeah, your teeth can infect any part of your body. Understand, when you swallow your saliva, where does it go? Think about it for a moment. You drink water. You drink water, bottle of water. Where does it go? A glass of water, cup of water. Where does it go? It goes to your stomach. It goes into your intestines. It doesn't just go right away to your kidneys that you pee it out, because one of the ways that we can remove water is through urination. Another way we remove water from the body, some water, by keeping balance of hydration in the body. We have to remove some, but store some. Some of it comes out in our stool. It's soft stool. Some of it comes out through sweat, and some of it comes out as a vapor when we're breathing, when we're exhaling. Well, a lot of the water we have to retain, our body's made up of 85% water. 80%, 85%, 87%, whatever that true amount is, we're made up of a lot of water. So when we drink water, it goes to our brain, it goes to our organs, it goes to our muscles, it goes to our skin, it goes to our ligaments, it goes to our bones, it goes everywhere. Your glands have water in them. Every tissue in your body has water in it. So when you drink the water, it goes everywhere. Guess what happens when you're swallowing saliva that's carrying microscopic organism infections from infected teeth? Even if it's a root canal that your dentist tells you is fine, you could be swallowing microscopic organisms that are going to everywhere in your body, infecting every part of your body. Well, with my unique scientific method that's very precise, I can find where the infections from the teeth went and provide safe and highly effective remedies to remove those infections from the tissues of the body. I found in her, on this July 1st, 2021 visit, activated mast cells in her entire bloodstream. Watch this video. I'm going to put a link up here to another video that I did about activated mast cells, or mast cell activation syndrome. Watch that 23-minute video, get more information about that. We're very effective when we can neutralize these out of the body with this method that I work with, the scientific and precise method I work with. I found her teeth infecting her spinal fluid, infecting her pineal gland, infecting her pituitary gland. I found Marcons, multiple antibiotic resistant staph bacteria infecting and affecting her skin. I found it in her gallbladder. I found it in her ureters, which are tubes down by the kidneys. I found her adrenal glands stressed, causing inflammation. Adrenal glands were stressed by residues from the tetanus shot or tetanus vaccine. And any vaccine for that matter, we can help neutralize out of the body, any of them. I found activated mast cells causing inflammation in her spleen, which is part of the immune system and circulatory system. I also found that these infected teeth we had extracted, they were diseasing her liver, which is part of hormone balance, digestion, detoxification of the body. The liver helps with so much. And when the liver's infected, infection can spread anywhere in the body, and the liver's not a good enough filter when it's diseased. It's not a good enough filter to clean itself out or clean or detoxify and clean the blood. Understand, we have to clean these organs. When was the last time you had your organs inspected? When was the last time you had a physician give you a report like what I just presented to you about what I did for her? When was the last time that a doctor was able to tell you where these different infections were in your body, even if they did a blood test on you and found that you had Candida positive? What if they found you had Epstein-Barr virus positive in the blood? What if they told you you had, let's say, like mercury in the blood, or in a hair test or a urine test? Where are those infections in your body, and are they the infections and/or chemicals that are causing you your individual symptoms? With my work, what I've been able to do for people, and you can look back at a lot of record of how I've helped a lot of people get over their chronic disease where nothing else worked. Nothing else worked for them. Hospitals, MRIs, CAT scans, respiratory doctors, cardiologists, immunologists, they're not getting the job done for many people. Rheumatologists, internists, psychologists. We can help you get well. We can help you regain your health. You can clean up your body from the infections and toxins that made your disease occur, and that's for sure. Go to my website and look around. You've got a lot that you can gain from reviewing my website. Watch the videos on my website. Look at the testimonials. Every page in my website has a different condition that you could see how effective we are and have been at helping people recover when nothing else would help them from all the doctors and the medicines and therapies that they've done prior. I'm very proud of that. I'll tell you, one of the difficulties for people out there is to realize that they have to make themselves a priority, and they've got to be able to take control of themselves. And part of the situation that we have with healthcare is people depend on their insurance to cover all the costs for everything when it comes to their health. Don't leave your insurance company in charge of your health. They are there if there's a catastrophe. I'm saying this to you because no matter how much we've tried, the insurance policies out there, all of them, do not cover the care that I offer. They don't recognize the services that I'm rendering on people. They don't offer the care. They won't cover the charges. So this will be an investment in you. This is your investment in yourself. Take it upon yourself to finally take control and get your life back. And I'm here to help you do that. Okay, you can contact my clinic at 954-370-3100. 954-370-3100. You can go right on my website and go to this FAQ, or frequently asked questions page. Please read through all of those questions. Those are the most common questions that people ask. And read my book. Watch the video at the end of the book. Click on that link. Get all that information before you contact my clinic. My assistant is here to help you find an easy way to set the schedule here in my clinic. We're usually on a waiting list for about 2 to 3 months, so be prepared. Get us all your paperwork, whatever laboratories, whatever forms we have you fill out, whatever laboratories, whatever imaging studies, whatever reports you can gain, so I can do a great investigation about you before I even get to meet you. I want to learn about you, study you, so I can be very prepared to find out what sometimes doctors have missed when they've looked over your studies, your labs, and or what they haven't found that's caused your problem. And we will find why. And it may take some time. Now, I'm going to give you this analogy I mentioned earlier, this picture. Imagine you loved putting together puzzles. You know, you get the puzzle box and there's a picture on the cover. You put pieces together. Eventually you solve the puzzle. You have this picture. You can put it up and frame it. You figured out the puzzle. Your body is a puzzle. Your disease is a puzzle. Your situation, your symptoms are a puzzle that we have to solve. Let's say that you love the Statue of Liberty. And you go to a toy store, you find there's a whole section of Statue of Liberty puzzles. You're amazed. You love it. When you look, you come down to a couple of different boxes, both of them on the cover. They have the same exact picture. You think the picture is a beautiful picture of the Statue of Liberty. One box has only 10 pieces to make this 3-foot by 3-foot picture of the Statue of Liberty when you solve the puzzle, when you put the 10 pieces together. The next box, same picture on the cover, same size puzzle when it's done, 3-foot by 3-foot, Statue of Liberty, same exact picture as the last one, 10 pieces to put it together, but this one has 500 pieces that you've got to put together to solve that puzzle, to make that picture look identical to the picture of the other box that's only 10 pieces. When you put that 500-piece puzzle together as opposed to the 10 pieces, it's probably going to take you a bit longer, isn't it? There's a lot more pieces that you have to figure out how to put together to solve that puzzle, to be able to produce the perfect picture of that Statue of Liberty. For you to liberate yourself from your chronic disease, that's what I've got to do. I've got to be like a Sherlock Holmes detective and figure out which pieces of your puzzle have to fit together. How many different infections and toxins are in those pieces of the puzzle, your organs, your thyroid, your stomach, your brain, your skin, your lymph, your bones, your stem cells. We've got to find it. We've got to start to put the puzzle together by removing these different disease-causing infections and toxins. It might be quicker for you than another person. It might take longer for you than another person. But I've got enough evidence here in this video of people with different terrible skin disorders, skin rashes, that have all been resolved. People regained their normal, healthy, youthful skin with this work that I'm offering you right now. I do look forward to helping you. Pick up the phone. Take action now. It's time for you to get your life back. I look forward to helping you. See you soon.
Before and after right now, and we still have a bit more to clear up, but amazing difference in your face. And you suffered for how many years with the red nose and the rash that was on the skin?
Almost 5 years.
5 years. And how many different doctors? Well, you had seen dermatologists, right?
Yes.
And how many of them were there that you saw?
6 different dermatologists.
And over what period of time did you seek out care from these 6 different dermatologists?
I was throughout the time I've been suffering so long, throughout the different years. I would go stay with one for a few months. Nothing. They couldn't give me an answer. They couldn't figure out what it was. Then I would go for another opinion a few months later.
Okay.
And I just simply wasn't getting any answers as what possibly the skin condition was.
And what type of testing did these dermatologists offer you?
They did a scraping to see if it was possible a fungus, and that came back negative. I also believe I did blood work and it did not show anything. Then they just would put me on antibiotics and also antibiotic cream, topical and pill form.
Did any of those sometimes make the rash worse, or did it just make no difference at all? No better, no worse?
It did not make a difference.
When you went from one dermatologist to another, and you had already seen 3 or 4 before you saw 6, when you saw it by the 4th one or 5th one, did you say, do you have anything else to offer me? Because here's a test that we've done and nobody's figuring out with it. I mean, did they ever say, well, we have a new strategy?
Yes, they said they can cut a piece of the skin, but they did not want to do that to send it out for further testing because since it was on my face, they didn't want me to have a scar.
Right, gotcha. So there was really nothing else then?
No, that was the last option, which we decided not to do since it was on the face.
Got it. And all the areas on the face where people could see the before, there was an oozing as well, you told me? I called it oozing. You may have a better description.
No, it was also.
It was an oozing.
Yes.
It was a white kind of pus-like stuff that was coming out?
Yes.
You called them plugs? That's a
yes.
term for me, plugs.
Yes, like white little plugs.
Like a string
out in your skin. Yes.
Yeah. And now we see that she's 100% nearly, if not perfect, 100% better. There's a little bit on the cheek that we're going to clear up, and that's going to be clear after this protocol. I believe that is going to be totally done. But it's amazing before and after. And your family, just by the way, and then I'll let you go. And I appreciate you getting on this discussion with me today to share with the world the difference for your skin. What does your family say? What does your mother say? What does everybody say?
They're amazed. They can't believe what a difference and how my skin looks so amazing now. And they're completely amazed at the transformation. I was so desperate. I wasn't getting help from anywhere. Plus, it's your face. You feel very self-conscious. And I came to see Dr. Herman. And thank you, Dr. Herman. You cleared up my skin. And now I feel more confident and have a little more self-esteem and don't have to always, want to mask up.
Yep. Excellent. Thank you so much.